Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for watching our channel. I hope you subscribe. We have almost 20 million views, and I speak to people on YouTube from all over the planet every day. It's such an exciting format. So if you don't know, I do cosmetic facial surgery in Richmond, Virginia. I only do from here to here, and I don't do boobs, bellies, and butts. So I'm a face guy. And I love going to work. I'll tell you, I just get so excited about doing facelifts and eyelid surgery. I'm just lucky, and I don't ever want to retire. I love doing this. Now, I do a little vignette of little videos on specific cases, and I call this a great little case. And it's a showcase of several cases, and it may be several eyelid cases or several facelift cases or several laser, whatever topic. And I just talk a little bit about the procedure, and I show the patients before and after and show you their improvement. So again, a great little case. And so today's great little case concerns face and neck lift. So we're going to talk about several great little cases, and I think it's important for you to understand that these are all my patients, of course. So this is case one, and this patient had face and neck lift, upper and lower cosmetic blepharoplasty, eyelid surgery, a chin implant, and full face CO2 laser resurfacing. So let's analyze this case. Preoperatively, the patient obviously had very heavy jowls, extra fat in the neck, extra skin in the neck, and a recessive chin. And the after surgery, we have tightened the jowls, we have made a more youthful chin, and tightened the skin around the neck. Here is a 3/4 view on the right of the same patient. So again, we look at the jowls before and after, look at the submental fat before and after, and look at the nice chin projection that we have. So many times, adding a chin to these other surgical procedures makes a huge difference. So this patient basically had no profile and had skin excess and fat excess, which you can see is significantly improved after her surgery. Another view of the patient, the left 3/4 view. Again, look at the jowl before and after. Notice that the patient now has a very nice defined neckline, where before there was a jawline, is what I mean. Before there was basically no defined jawline, and we have this because of the chin and the facelift and the liposuction and the other procedures that we perform when we do a facelift, we have this very youthful jaw outline and neck. And again, another photo of this patient from the other side, where we have just done miraculous things, I think, with her profile and given her a chin, reduced her jowls, tightened her neck skin. And I'll tell you, as a surgeon, this really excites me. It really makes me feel good to know that I can help a patient like this. This is case number 2, and this is a face and neck lift with upper blepharoplasty. And again, it's very common that we're doing eyelid surgery when we're doing facelift surgery. So this patient, we can look at their eyelids and see the skin excess before surgery, and we see how we've eliminated that after surgery. And again, a facelift is for the lower face, so this patient had jowls and all this extra neck skin, and you can see how we have improved her jowls and given her a nice jaw outline and tightened her neck skin. Same patient looking from another view, looking at the eyes, and then looking at the jawline. And again, it's, these jowls, when these form, we kind of lose our jawline. And when you do a facelift, that's a big part of the procedure, is getting that jawline back and getting rid of this crinkly neck skin. And you can really tell in the side profile that we've improved this skin excess and improved the jawline, and again the eyelid. Here's the 3/4 from the left side. So by eliminating the jowl and eliminating this extra skin, and when you do a facelift, you actually get a little bit more cheek because you're pulling everything up. So you get some cheek augmentation without having to do a specific cheek procedure. And finally, on this patient, the left profile view, which again shows the improvement of the jawline, shows the improvement of the jowl, and getting rid of this excess neck skin. And this is just an auxiliary pose just to show the redundancy and its improvement when the patient is looking down at the ground. And if you look at these pictures, this is before surgery, this is after surgery. So I take great pride in my scars, and I feel that I've really developed a great technique for in almost invisible scars in my decades of doing facelift surgery. So again, this is before and this is after. And the scar after surgery is the surgeon's signature, and I invest a lot of time and precision into making beautiful scars. Case 3, this is face and neck lift, upper eyelid surgery, and laser resurfacing around the mouth. So if we look at this patient, who obviously wanted to remain anonymous, we see this extra skin and jowling. And when we look at this patient, you can see I just lasered these lines on the chin and under the lip. And if you look at that, you can see the improvement from the laser before and after. You can also, of course, see the profile improvement from the facelift and the tightening of the neck skin. Again, this even shows better how we were able to improve these wrinkles with the CO2 laser. And you can see how we have a nice soft jawline here now where we got rid of those jowls and have a better defined jawline. And again, this is the before, this is the after on the right side, before, after on the left side. And having done almost 1,300 facelifts, which you figure means 2,600 incisions because there's 2 incisions on each side of a facelift, I have really developed a technique that has been very predictable. Case number 4, this is face and neck lift, upper and lower eyelid surgery, and CO2 laser around the eyes. So this is an older patient, and again, looked so tired, and all of the skin excess just makes us look older. So by doing upper blepharoplasty, lower blepharoplasty, and CO2 laser, we have really taken decades of aging off of her mid-face. Again, doing a face and neck lift, if you just look at the area on the jowls, at the neckline, the jawline, obviously you can see the improvement that we have made. Looking at the patient from the right side, same type of improvement. Looking at the eyelids, looking at this extra skin. This patient has a little bit of skin excess here. We're going to go back and actually tighten that with a laser because this patient really is in need of a full face laser, and we're planning to do that as the final step. So I tell patients when we're doing facelift surgery and eyelid surgery, so we're kind of like rebuilding a car, and when we do the laser, we're painting the car. And if you look at the eyes before and after, and look at the lower face and neck before and after, you can see significant improvement. We have given this patient a profile, and she has a little bit of hyperpigmentation here from the laser. That's not uncommon, and you can use bleaching cream on there, or generally it will just go away by itself. But again, we're planning on doing a full face and neck laser on this patient to further tighten things. But this is an age-appropriate correction. And if you have an older patient and you make them too tight, they're probably going to be unhappy because they want to look better. They don't want to look fake. And again, you can pretty well see the obvious changes of the upper and lower eyelids and the extra skin and festoons that this patient had. And her before and after. So she has a nice shelf now if she wants to apply eyeshadow or makeup, and we've gotten rid of those big bags and made great improvement there. Okay, and the last case here is just face and neck lift by itself. And again, another patient who does not want their identity known, and that's not uncommon. Many patients don't care if you use their pictures, and of course we always respect the patient's wishes. But I'm glad this patient let me use these pictures because you can see she had this droopy jowl here, and she had basically this very broken up neckline, jawline, and now you see that we have this really nice distinct jawline, and she had this extra neck skin which is now same thing. By restoring somebody's jawline and tightening their neck skin, getting rid of their jowls, that really makes a more youthful profile, and that's the gist of what a facelift does. Same picture looking at the left, jowl improvement, and look at this, what a beautiful jawline. It makes me feel so good that I was able to restore that patient's jawline. And again, showing this view where it illustrates the amount of redundancy that the patient had and how much we have improved that. So thank you for looking at these 5 little cases. I actually have about 9,000 before and after pictures on my website, and any surgeon can just show their best cases. But I like to show a variety of cases and show cases in the real world, because once in a while you're going to go back and you're going to do another procedure, or maybe some patients may even need a little nip or a tuck after surgery. So it's important for a surgeon not just to show their greatest cases, but a representative mix of what happens in real life. So I love what I do, and face and neck lift is my signature procedure, and I feel that by doing 1,300 facelifts over several decades that I've been able to put together a very predictable and safe procedure, and that's really important. The two things that we have to do: the patient has to have a safe experience, and they have to have a natural outcome, because for me to look good, they have to look good. And I always tell patients, it's your face, but it's my reputation. And I'm honored that we have an international practice. We see patients from all over the country and outside the country, and we are set up to make surgery safe and easy. So I'm Dr. Joe Niamtu, lovethatface.com. We are in Richmond, Virginia, and here is our phone number. So I will present these great little cases, and I'll continue to do this for facelift and eyelid surgery and implants and lasers and other types of cosmetic facial surgery that I do. And I think that presenting just a small number of case studies is a powerful way to show people what improvement can be done and what I personally can do as a surgeon. Thank you so much for the greatest gift of all, and that is your time. I'm Dr. Joe Niamtu, lovethatface.com.